As the influence of suburban development and climate change expand tick ranges and increase the risk of tick-borne illnesses, the threat to our families, our service members, and our community only grows. We need to do more to fight the spread of this disease. This week, I'm pushing to pass the Hagan Tick Reauthorization Act, which would support research, prevention, diagnosis, and treatment for tick-borne illnesses. Good morning, everyone. Thank you for joining us. I hope that you have had a great summer so far and have had some time outdoors. As a nature enthusiast, I love to spend outdoors, but when you do go into nature, you need to be careful, especially in the summer. You need to wear sunscreen, you have to bring water, you need to protect yourself from tick-borne diseases like Lyme disease. Tick-borne diseases are a growing public health crisis, particularly in our state, which has the highest reported number of Lyme disease cases in the country. In 2020, just over 2,200 cases of Lyme disease were reported in New York State. But by the end of 2023, that number had skyrocketed to over 22,000 cases. Areas like Suffolk County, Orange County, and Westchester County have some of the highest numbers of cases throughout the state. But even areas like New York City are seeing a concerning rise in cases too. A bacterial infection spread by infected deer ticks, Lyme disease, can cause symptoms that affect the nervous system, joints, skin, and the heart. Many patients suffer from infection-associated chronic illnesses, experiencing symptoms for months or years after treatment. More than half of all adult deer tick collected and tested in New York State carry the bacteria that cause Lyme disease. Service members and their families are particularly at risk, as this vast majority of military bases are located in states where exposure to ticks and the diseases they carry is especially high. That means that tick-borne diseases also pose a threat to our military readiness and therefore to our national security. As the influence of suburban development and climate change expand tick ranges and increase the risk of tick-borne illnesses, the threat to our families, our service members, and our community only grows. We need to do more to fight the spread of this disease. This week, I'm pushing to pass the Hagan Tick Reauthorization Act, which would support research, prevention, diagnosis, and treatment for tick-borne illnesses. Named after the late senator from North Carolina who passed away from complications of a tick-borne disease, this bill would require HHS to continue implementing and updating its national public health strategy to counter vector-borne diseases in people, reauthorize regional centers for excellence in vector-borne diseases for 5 years, and reauthorize CDC grants to state health departments to improve data collection and analysis, support early detection and diagnosis, improve treatment, and raise awareness. This legislation will be instrumental in keeping our families and communities safe, as well as helping to protect our national security by keeping our nation's service members healthy and ready to serve. In addition to this bill, I am also pushing for a total of over $200 million to support research and programs that address Lyme disease and other tick-borne illnesses. This would include $30 million for the Department of Health and Human Services to implement the Hagan Tick Act, $35 million for the CDC to further its Lyme disease and tick-borne illness work, $9 million to support the Department of Defense's tick-borne disease research program. That markup is happening today, and I'll be pushing hard to secure those funds. $130 million for Lyme and tick-borne illnesses research at the National Institutes of Health. New Yorkers deserve the freedom to spend time outdoors without worrying about facing serious illnesses from a tick bite. This bill just passed out of the Help Committee yesterday, and I will keep working with my colleagues in Congress to pass it into law to support these necessary efforts to protect the health and safety of our communities and loved ones.
Senator, I take it you're taking questions now.
Yep.
This is Holiday Moore at WAER in Syracuse. Can you talk about, if you feel knowledgeable about it, about the other tick diseases that are also on the rise, anaplasmosis, I think it's called babsiosis, and ehrlichiosis. Are you getting reports that these also are in that that span of other tick-borne illnesses?
Yes.
Rise in New York, and can you talk about that?
Yes. I think the last I've seen is, let's just see. So far, there's 143 reports in 2024 for 2 of the ones that you just mentioned. babesiosis and anaplasmosis. Um, I also think there's, the last time I checked, I think there's 19 tick-borne illnesses that we have identified to date. Not all of them have very good testing to assess them, sorry. But this research and these dollars would go a long way to meeting those needs. Because if we have 19 different strains of tick-borne illnesses and we only have testing to identify 2 or 3 of them, that's problematic.
Senator, this is Ruben Jones with Spectrum News. Thanks for doing this. Can you just talk about the how important it is to have Kay Hagan's name attached to this, and maybe what has been learned since her passing from tick-borne illness?
Well, I don't know if you remember Kay Hagan, but she was one of my colleagues and she was an extraordinary woman. She was hiking and she got bit by a tick and she was relatively short term thereafter hospitalized, fully immobilized. She lost her ability to move. She was in a wheelchair. She had the Powassan virus, which is very prevalent in the, I think it's the Southwest, or no, the Southeast. Yeah, the Southeast where her state was, North Carolina. And ultimately she died from it. So the reason why we want to put it in her name is we just want senators and Congress members to know no one's immune from these types of risks. They can hit any family member, any loved one at any time. One of the biggest challenges we've had over the last decade is just our medical professionals being more knowledgeable, really asking the research to be done, asking for the testing to be done. We're doing research as well on vaccinations to try to prevent the disease. So these are serious issues. And if you've met anyone who has a tick-borne illness, they can be extremely debilitating. All of them, no matter which one you get. I've had multiple strains of tick-borne illnesses. My family members have had multiple strains of tick-borne illnesses. We live in upstate New York. It's very prevalent in upstate New York. And if you have young children, you have just to make sure you do tick checks every night when they come in from playgrounds and being outdoors. You have to check your dogs to make sure they're not bringing ticks into your house. So I've done a lot of work on this issue for a long time, and it's just a very serious issue that needs a lot more attention.
Thank you.
Senator, I hate to bogart, but can you, this is Holiday again, can you share with us what the doctors are telling you or the professionals are telling you about why it's expanding or it's increasing so rapidly, especially in central New York?
Well, there's 2 reasons. The first, global climate change is affecting how cold it is in the winter. And what happens during the winter is ticks die off because they freeze to death. But if the freeze days aren't long enough or have as many freeze days, they don't die off. They stay alive on deer and other types of animals. And so the percentage and the number of ticks that are blooming in the spring is just exponentially higher. So because of that, the changing of temperatures, the range is changing of where ticks are located. So you used to not have them in the far north because, again, you'd have a massive kill off of ticks every winter because the cold. But because of global climate change, it's shifting. And so the range is different. The second reason why we have more cases is doctors are becoming much more knowledgeable than ever before. So when they have a patient who comes in with multiple symptoms, they will now try to test for tick-borne illnesses. Whereas 10 years ago, they would only test if you saw a bullseye. Many people will get a tick-borne illness without ever seeing a bullseye. A bullseye is the red mark around where the tick bite occurred.
I have an off-topic question, but I'll wait until everybody's had their tick-borne questions if you're willing to take it.
Sure. Anybody else have the tick-borne illness question?
I'll just ask one more on the ticks, if it's okay. So just in regards to the CDC, obviously there's been a lot of cuts, a lot of changes there. Have you had any communication with the CDC? Are you worried that research and more is not being done as the CDC undergoes these changes?
Yeah, so we've talked to a lot of our providers and the CDC and the NIH. We've talked to a lot of our research hospitals. We also have talked to institutions that do this work. There's one, the Trudeau Institute in Saranac Lake, that has been at the forefront of tick-borne illness research. They did research into vaccinations. They've done multiple years of research. When all this NIH funding is getting cut, all the CDC grant money is getting cut, it just means less research and less advancement on cures and less advancement on prevention. So they are anxious about all the cuts.
Senator Brian O'Neill, WLEA.
Yep.
Was there anything in the one big beautiful bill addressing Lyme disease maybe you agreed or disagreed with, or was it there at all?
No, it wasn't in there. Just cuts to the areas where they might be funded.
Thank you. Can I do an off topic?
Yeah, just 1 second. I'm just checking. The good news about this Hagan Tick Reauthorization Act is that it's bipartisan. So we have both Senator Collins, Senator Hawley, and Senator Marshall on the bill, which is very helpful. And then when they had a markup in the Help Committee on it, it was a unanimous vote of 23-0. So I'm optimistic that we can get some of these resources back in. Just speak what?
Oh, so the budget is still your markup today, which includes funding for the CDC programs.
Yeah, and hopefully there'll be some money in the appropriations bill that's being passed today.
So I have the off-topic question. I think somebody else just said they did too.
Go ahead.
I am looking at today's release by the Gallup polls, and it's saying that there is a significant shift in the number of independents that are registering to be Democrats. But it also shows that there is no more trust in the Democratic Party as there is in the Republican Party. Pete Buttigieg was on he's been very vocal in the last 72 hours and saying that the Dems need to come to an agreed messaging, and they've been horrible at branding. Are you on the forefront of that branding, or do you have any ideas of what the messaging should be for the Dems going forward to capitalize on this newfound transfer of registered voters?
Yes. So the biggest issue that voters that I've talked to care about right now is the cost of their everyday lives, the fact that groceries are too expensive, housing is too expensive, and transportation and healthcare are too expensive. So costs are one of the most driving forces in people's complaints and concerns. So they want to make sure that their elected leaders are laser-like focused on getting those costs down. Second, people care deeply about access to healthcare. These cuts to Medicaid and Medicare are debilitating and frightening to so many Americans. So guaranteeing healthcare is a right, not a privilege for the wealthy. And then last but certainly not least, people want to know, what's the American dream for this generation? They want to know what is the promise that America makes to its new generation, to its young people? What is the opportunity agenda? What is the pathway to success? And how do we increase entrepreneurialism and innovation and an aspirational economy? And so that bucket of ideas about how to accomplish the American dream for today is something I'm working diligently on, which will include opportunities for lower cost housing, opportunities for first-time home ownership, opportunities for better, more usable education. So much more skills building, much more apprenticeship programs, much more translatable skills learned in college. College for service, paying for people's education in exchange for public service is very much part of that opportunity agenda. And then looking at healthcare and saying, like, how do we make sure moms aren't dying giving birth? How do we make sure we have the resources for children and for new families and for older people? those are all part of what this opportunity agenda will look like. And I'll have it written for all candidates to look at in the next few months. So it's something very important for Democrats. These ideas aren't new. We have always believed in the American dream. We've always believed in success and prosperity for everyone. We just have to focus on those issues over other issues. And sometimes when we focus on so many issues, we dilute our message and our message gets lost.
So am I understanding that the message I kept hearing you say is the opportunity for the American dream? Is that what you guys are going to be kind of throwing?
An opportunity agenda, a prosperity agenda, a renewed commitment to the American dream, any version that a candidate feels is best for his or her, it'll be along those lines. It's a very strong and directed economic message about opportunity, about innovation, about prosperity, but also the everyday costs and driving them down and what we're going to do to make sure people can feed their families, someday buy a home, maybe get into a bigger apartment, have their kids have skills building so they can get great jobs, even in the era of AI. So this has to be a very robust plan about opportunity for everyone.
Thank you.
You're welcome.
Senator Brian O'Neill.
Yep.
On the DoD PFAS legislation you've been talking about lately, I got at least 2 VA hospitals in the listing area for the stations I work for. Wondering, is that a common medical problem for VA patients to be suffering from PFAS issues? Have you heard that from the VAs?
Yes, there's a lot of PFAS on military bases. If they do any firefighting drills, they were required to have PFAS in the foam for decades. So there's just a lot of exposure issues. And because of that firefighting foam issue, the PFAS lingers on the bases, in the groundwater, in the runoff, in the ground. So they get a lot of exposure. So it's a huge issue for our military.
Thank you.
Senator Terry Frank at Media One.
Hi, Terry.
I did have a question. You brought up Senator Hawley earlier, and he has a proposal now to ban stock trading by members of Congress and the president and vice president. It's won bipartisan approval to advance in a committee vote. I wanted to get your thoughts about that.
I support the legislation. It's very similar to the bill I was writing with Senator Hawley. And I'm not on that committee, but so he introduced it on his own, but I support it fully. And we should ban for all members of Congress, all senior administration officials, including the president and vice president, stock ownership, buying and selling, and include cryptocurrency and blockchain and meme coins.
Thank you.
All right, thanks everybody. If you have anything else, reach out to Evan. Appreciate it.
Thank you.